part of my advocating role that I do a lot of, I used to work really closely with the International OCD Foundation. And there's a group of advocates. And it's really interesting. There's two groups. There's the one group that thinks you're done no matter what, you're going to struggle for the rest of your life, it just sucks. And then there's the other group that has, they know that it's hard, but that there's hope out there if you get the right help, right? And I definitely fall into that group. And it was funny because we used to kind of consider it like the hope group. So it's really ironic that that's the name of this talk, because there is hope as long as you're willing to, or not willing to, as long as you have the resources, or maybe you know about the resources, right? So that's where I can't wait to hear Matt's talk, because, you know, just knowing where the resources are is sometimes super important, right? So I am going to give a little bit of advice, and then I want to make sure that we have some time for questions at the end as well, also. But the first thing I want to say is if you are struggling, please reach out for help. There is help out there. Go to your counselor in your office. The academic counselors are not there just for ed plans. They should be there also for personal social stuff if you need something. All right, so reach out if you need anything. Message me on Instagram and TikTok. I gave a talk to a group of athletes just a few months ago, and I had some direct messages on social media, and I've been talking with them recently. So if you message me on Instagram or TikTok, TikTok's kind of odd. It kind of goes to the spam. Go to Instagram. But if you message me, I will absolutely 100% message you back. So please, if you're struggling out there, get help. I tell my students all the time, I say, look, if your car is broken, you take it to a mechanic. If your brain is broken, you go to a therapist. Like, why are we willing to help our car but not help ourselves? If your stomach hurts and you get COVID, you go to a doctor. If your head hurts and you're struggling, why not go to a therapist, right? There's such a misconception out there. It's really ironic, actually, and one of the reasons why I wanted to get into the advocating and posting and trying to be more public about this is when I pull my Instagram and TikTok numbers, this is just kind of ironic to kind of hit home on why this is so important. As my Umoja students say, I'm a little TikTok famous at times. A few videos have gone a little viral. But I can pull analytics, and 80% of my followers are female, but 60% of my direct messages are male, right? It's really interesting. And of those 60%, about 20% are from the Middle East, which is kind of cool. So I say that because that's one reason why I want to be out here and talking about it, because it's such a stigma that is below the surface that we just can't talk about it. We're not willing to go. I don't know what it is. Some of it's cultural, some of it's pride. Who knows? It doesn't matter what it is just. So please get help. You're going to fix your car, fix yourself. Okay? Please go out and get help. The world is better with you in the world.